Health Nuts, episode 33.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I got a great friend of mine on, Dr. Brie Stemmler. She's a board-certified and Webster-certified chiropractor who's best known for her work with expectant mothers and young children. Her passion is to help women feel strong and vibrant while pregnant and to enable the birth process to be as stress-free as possible for mom and baby. She's been helping families thrive with chiropractic care for over 10 years. She's a graduate of Palmer College, a presidential scholar, and a member of the American Pregnancy Center. She's been named Best Chiropractor from the Reader's Choice by Trib Tittle Media and was featured in the Women of Business section of Pittsburgh magazine. Dr. Stemmler is certified by the ICPA and is a member of the American Pregnancy Association. Dr. Brie's Vitality Center, Live Well Chiropractic, is located in Wexford, PA. Dr. Brie, we've known each other for years, but to give you a formal intro, I know a ton about you. Welcome to the podcast.
Yeah, thanks for having me.
Looking forward to hearing you on. Tell the audience a little bit more about yourself.
Well, like you said, I am a Webster certified chiropractor. I work in Wexford, Pennsylvania, but I am originally from Eau Claire, Wisconsin. So if you hear the accent come out, that's where it's from.
Oh, it's there. It's not gone yet.
If you hear a couple oh yeahs. Yeah. I am a mother. I have a 2.5-year-old son. He's keeping us pretty busy right now. And we also have 2 bulldogs that we love and adore. My husband is also a chiropractor, so he works here at the office with me. And we just like hanging out as a family, being busy, spending time outside. Not so much right now, but
yeah,
when the weather gets good, Pennsylvania is pretty beautiful. Yeah,
you know, it's the time of the season, and it's kind of the place we're at right now. So for the audience that's out there listening, Dr. Brie is a specialist with pregnancy chiropractic treatment for the expectant mom as well as the young baby after the fact. So for those new moms and dads that are out there, this podcast is for you. If you have a baby on the way, this podcast is for you as well. She's got tons and tons of experience. She's going to give you her story and then just ways to go about going through your pregnancy as healthy and as drug-free as possible. Before I get to that, I always like to start off with an affirmation, words of wisdom. What do you got to go with?
So again, growing up in Wisconsin, I was always a big fan of Vince Lombardi. And when I gave the speech at graduation, and I had to come up with a quote. It always just kind of stuck with me. The price of success is hard work, dedication to the job at hand, and the determination that whether we win or lose, we have applied the best of ourselves to the task at hand. And I just try to always give 100%, be present and focused on what I'm doing, whether it's spending time with my son, at work with my patients, or spending time with my husband.
You love it. So I think it's one of the takeaways from that is, you know, especially being a small business owner, you know, failing, which I know you've personally done as I have as well, especially when we first bought our practices, we had some things happen to us. But when we failed, I would think that you have failed forward. So I think it's something you do on a daily basis is work hard and try not to make the same mistake twice.
Yeah, you learn from everything, and as a parent, there's a lot of failures that happen too, and you just, you know. But I think if we're present with what we're doing and we're giving our best effort, you know, at the end of the day, we tend to meet our goals and at least, you know, get where we want to be in life.
Love it. So the meat and potato of this podcast can be on prenatal and postpartum chiro care.
Yes.
What made you get on this road?
So I started taking care of pregnant women well before I became one myself, but I was just always really connected with moms and kids. And I think it's such an amazing thing that women get to experience. And what had happened is I kept meeting so many women that really did not enjoy and did not like being pregnant. And many of which even said they didn't have more children because they had such a bad experience. And most of the time the complaints were sciatica, back pain, trouble sleeping, things that can be helped with chiropractic care and really shouldn't dictate somebody's life choices for expanding their family. So I started taking more and more seminars, getting different certifications along that way, and it is just awesome. I mean, it's such a fun time to be in somebody's life. I mean, talking to a pregnant woman and what they're going through and the experience that they're having, it's, the excitement, especially for first-time moms. I mean, it really is just so fun to be a part of that.
Yeah, it's something that I've seen throughout practice, not close to the volume that you have, so I know that's more of your specialty. But it is really cool to see see a patient coming in, and if they're symptomatic, I know we're going to get into some of the things that can happen during different terms of pregnancy, and to help them get through there. Because one of the things we don't want them, they really can't even go on. They used to say you could take Tylenol while you're pregnant, but then there were studies that came out saying there's side effects to the baby long term if you're on Tylenol, long term while you're pregnant. So help them through there to kind of not only throughout the period when they're pregnant, but also for their labor and delivery as well. It's pretty cool.
Yeah, and I work with a lot of OBs and midwives and lactation consultants and everybody along the way. And there's just ways that we can help them with chiropractic that other specialties can't, and it just all works really, really well together. And there's also a lot of research just about the emotional impact of mom on the developing baby. So if mom is feeling negative and stressed and not having a good experience, what does that do to their developing child? So, happy moms make happy babies.
I love it. So how does somebody know if somebody's pregnant? What are some things you're looking for to say, hey, you know what, maybe you should go ahead and get checked? And if you're a candidate for treatment, what are some things you're looking for?
So usually the panicked calls that I get are when somebody is having a lot of pain moving, they're unable to sleep, they're just in a lot of discomfort. And of course, then that leads to worrying about, well, how am I going to get through labor if I'm already have pain just laying in bed? And then on the other side, I get a lot of women who just want to try to have the healthiest pregnancy possible. And moms talk. So they heard from somebody that they had chiropractic care and it was the best thing they did during their pregnancy. And of course, as we know, wellness is a lot easier. But we can get people out of pain pretty quickly. So, if you're noticing difficulty sleeping, difficulty, getting in and out of bed, pain going down your leg, pain in your pubic bone, digestive issues, headaches, those are a lot of the things that we see. And again, they're really something that people don't have to suffer with. And I think a lot of times we think we do because pregnancy is supposed to be miserable, right? Oh, you're pregnant. Of course you're going to feel crummy. And it's just not true.
Yeah, the rite of passage of being pregnant.
Yeah.
What's digestion? And I know the correlation for this, but for the audience, the digestions, it's so common to go through an acid reflux based condition. Usually it's in one of the trimesters of pregnancy. What's the link there between some of the digestive issues and pregnancy?
Yeah, so there's a couple things happening. One is that as baby grows, everything's really being shoved up. All your organs are moving around, and if you go on Google, you can find some pretty cool videos showing how everything moves. But the other thing that happens is as belly grows forward, your lower back starts to translate backwards, and we round a lot through the shoulders. And that's how we get the kind of boobs on the belly, which is why as women get bigger, it can be uncomfortable for them to wear bras and certain shirts. And when we get that rounded, we put a lot of pressure on the middle of our thoracic spine, and those are the nerves that are going to a lot of the digestive things. So, and then of course, your stomach is getting shifted around, so you get, fuller quicker when you eat, so small meals throughout the day. And sometimes it is just part of it, but if we can control it, I had horrible acid reflux through my pregnancy. And it was controlled with chiropractic care. And then as soon as baby came out, it was gone. And he did come out with a full head of hair. That's one of the kind of old wives' tales about if you have digestive stuff, is baby is going to come out with a lot of hair. But in my case, it was true.
In your case, it was. So the other, I think the other most common symptom, at least that I get, is the digestion's one, and then the lower back sciatica is the other one. What's the correlation there?
So the pelvis is just doing a lot of work. It's got a lot of pressure. The relaxin hormone is making everything expand, which is awesome for delivery. But when you have that instability, it's just making all those muscles work a lot harder. Our core starts to get really stretched out, so we recruit our lower back muscles. And then, of course, just with the tucking of the pelvis and everything shifting, it's very easy to irritate the sciatic nerve and the nerves of the lumbar spine.
What are you telling the patient who's coming in and they are they're symptomatic, and they're coming in for rehab, and they're either going through some of the symptoms we touched on? What are some things maybe you're telling them to do at home, or some things they can do outside of your office to work on stabilizing their health?
So in the office, the most important thing that we do is we get them adjusted. We work on sacral balance. We work on the pubic bone. We check the round ligaments. We check the thoracic spine. And then at home, depending on the person, there can be some very safe core and pelvic floor exercises to do. Cat and cow is always a good one. Getting some pelvic tilt, working those glutes, doing some squats. In fact, a lot of the pregnancy books that you'll read, so I have this one pregnancy book, it's called Essential Exercises for the Childbearing Year. It's from the 1970s, as you can easily see from all the pictures in it, but it talks a lot about movement and stretching during pregnancy, and one of the things that it always hits on is squatting and getting into a low squat, and that's why birthing in that position is so good. It really helps to relax the pelvis. So working on squats and getting to that low squat position can be really helpful. Movement is really key. I think we become pregnant and we're like afraid that if we move, we're going to hurt the baby's going to fall out. But I wouldn't recommend somebody, take up CrossFit if they've never done it, or try something brand new. But movement is really good. It's good during pregnancy. It's good during labor. It's important to work the core and work the glutes, because that's what's going to help you push that baby out. Yeah,
and that's one of the things that I think one of the misconceptions that are out there is that when you're pregnant, you shouldn't be doing exercise, or it should be really low key, and you should just be doing mild walking. Yeah. And I completely agree. There's functional movement that can really help aid in the labor and delivery of the child. So I'm assuming you're going to say with functional movement, you'd say yoga type stuff, Pilates, low force exercise?
Yeah, absolutely. Of course, every person's going to be different. So you want to make sure that depending on the person, it's safe during their pregnancy. But kind of across the board, the things that I would avoid are any sort of twisting or abdominal crunching. When we crunch up, the abdominal wall can push out. And that's something that we want to avoid. So instead, doing planks, bridges, a lot of the yoga type movements, Pilates type movements, in addition to, walking, running, biking, you can definitely add those things in as well. And we might have to modify as we go through pregnancy, but, staying moving is important. I practiced up until the day I went into labor. My water broke in the office. And I really think that having a physical job and moving around a lot really helped me have a good pregnancy.
I didn't realize you worked that long. Good for you.
I did. Yeah. I got done adjusting a patient. I said, I'll be back down for the next one. I got to go to the bathroom, and I didn't come back down.
That's it.
Yep. So my husband finished up with patients, and I came down to get lots of hugs, and it was a great morning.
Yeah, it's one of the best things about being a male is we don't have to have a baby. I don't know how, if guys were given kids, I know I wouldn't do it more than once. After seeing my son being born, there's no way.
Yeah, I know. I mean, dads have a really important role as well. And, one of the things when when women do come in, as I encourage them to at least, bring their partner with them, so I can show them a couple things that they can do to support the hips and the pelvis and stretches, during pregnancy and during labor. And you're the cheerleader, the coach, the bodyguard, doing a lot, and that support really, really is important to moms.
Yeah, it's huge to have that support. I always like it when they come into the office. We'll doing a consult. I'm like, yeah, we're pregnant. I'm like, you're not pregnant. Your wife's pregnant. You're along for the ride. You're holding the hand. She's the one who's got to do all the heavy lifting at this thing. But yeah, the support is such a huge thing. But
at the same time, I think yes, it wasn't super fun when I couldn't see my ankles, and there are some tough things that happen during pregnancy. But women are tough, and our body is designed to do this. And it's the same when you become a parent. There's some tough moments, and you just try to focus on the positive. And I think it's really cool that we get to experience it. I know, men are probably happy that they don't, but I think for women, if they want to have a baby, it is a cool thing.
Yeah, it's just amazing to see the life from one single cell, or from one cell, and it just turns into. I mean, the female grows a brain, a central nervous system. I mean, it's just amazing what happens during that process. If you really take a step back in the 1,000-foot view to actually look at what's going on, it is crazy what's happening inside the body.
Yeah, it is amazing, the change that happens, and and I always tell moms, like, embrace that change. It is an amazing thing that you get to do. Don't worry about how your body's going to be after, what you're going to do after. Just focus on what you're doing right now and how awesome it is.
I think some misconceptions about pregnancy and chiropractic might be that maybe it might be the mom or the child might get injured, or they might have a strain in their back. What are some things you've come across with maybe some myths that are out there that we can address?
Yeah, I mean, I think there's definitely that fear that maybe it'll be too aggressive, maybe there'll be an injury to a joint, and chiropractic during pregnancy is very gentle, and that's why I think it's important to find a chiropractor that is experienced with pregnant women, because it is gentle. Webster's technique looks at all areas of the pelvis, and we're never pushing on anywhere that baby is. I always tell mom, I'm not treating baby. So sometimes if I'm working on the round ligament, baby might give a little kick to say hello, but we're never touching baby, trying to manipulate baby. They're, just hanging out there, and we're just making a more roomy apartment for them.
So maybe the mom is the newly pregnant mom that's out there. Maybe it's someone who's in their second try, and they're listening like, hey, you know what? Some of this is making sense to me. I'm having some of this going on, and I'm not liking the answers that I'm getting from the practitioners that I'm currently seeing. What do you tell that person?
So yeah, it's funny that you say second trimester, because typically around 24 weeks is when we start to see a lot of the back stuff kind of start to kick in. I would definitely tell them to find a Webster certified chiropractor in their area. In fact, they may, their OB or their midwife might have somebody that they recommend. And go and sit and talk with them. Make sure you find a practice that is a good fit for you and you feel comfortable. But it is very gentle. In fact, the tables that I have, the abdominal piece pushes away. So when mom lays down on her stomach, the belly goes in a hole. And most of the women love it because they haven't laid on their stomach in a really long time. So it's a nice, relaxing position. And it's, it's safe, it's gentle. And it's important to me that women feel strong and ready to take on the challenge of labor, and that they enjoy the experience of being pregnant and all that comes with it.
What about the change in the body that's taken place? I think, obviously there's weight gain that comes with this. And you find, at least I found that, it can be really a negative reinforcement with the more and more weight that the mom's putting on. And then, as you talked earlier, with the cankles that are taking place. So somebody's maybe put on more weight than they were hoping for, and now they're kind of down in the dumps because they're thinking they're never going to get that weight off, or it's going to take them forever and a day to lose the 25, 35 pounds they put on. What do you say to that person?
again, just to accept the change in their body. I mean, I know women who have, healthy diets, stay active during pregnancy, and they gain 65 pounds. It happens. Your body is just going to have a certain response to pregnancy, and just try to make the best health decisions that you can. Work with your doctor, your doctors, and make sure you're doing the things that you can and controlling what you can. I've always been a very fit person. I love to exercise, and I kind of thought when I was pregnant, like, oh my gosh, this is a big change happening. And afterward, that little baby came out, and I could have cared less. I was just focused on his sweet little face and breastfeeding and making sure I was fueling my body correctly. And then it comes when you're ready for it. We can, it's a big change to the body. There's going to be some changes that happen afterwards. And I know people don't like the phrase, get your body back. And there's all these articles about how to get your body back. And your body will be different, but different doesn't mean worse. And you'll find things that work for you afterwards. And I think we think about it a lot during pregnancy. And then once we become a mom, it
all goes away.
The importance level of it just goes down.
Yeah, I completely agree. As I saw it with my wife, and I see how kind of my thoughts prior to and then after the fact as well. Kind of the things we think are important just don't seem to be as important after the fact.
Yeah, and I think it's just something everybody has to go through and get to that realization themselves. But it's just like anything as a first-time parent, right? You go to the store and you buy all this stuff, and you think you need to have all this stuff, and then you barely use any of it. And as long as you have like a diaper and a swaddle, you're good.
We spent hours on end. It was like our Friday rituals. We'd go to Babies R Us and we'd walk the aisles. I'd be like, how much? And you're right. It sat in the closet.
Yep. So much stuff. But it's part of the excitement. And so, again, I think every parent just has to go through it and enjoy it and, make it part of the experience.
So the podcast, as you know, it's called Health Nuts, and getting into some other things for the mom to be, or the mom who is just had a baby. What are some health nuggets you can share with them?
So one of the things that I find a lot of women don't know about when they're pregnant is the difference between folate and folic acid. So I always tell women to research that a little bit, talk to their doctors about that, because most prenatals that you will buy, even by prescription or in the store, are going to have folic acid in them, and we really want to look for folate. And if you're not getting it in your prenatal, you definitely want to make sure you get it in your diet. So the difference is that folate is the natural form of B9. And anytime something is the natural form, our body can take it in a little bit better and digest it a lot better. So folate is important for prevention of neural tube defects is the big one that's talked about. But it does a lot of other things too. It supports the nervous system, the development of red blood cells, helps avoid low birth weight. And a good way to get folate in your diet is to do green vegetables, so spinach, kale, asparagus, broccoli, eggs, and citrus fruits. I primarily did like oranges, strawberries, raspberries were kind of my go-tos.
Yeah, I love that. And that's such a huge discrepancy. Most of the over-the-counter prenatals, you're right, it's folic acid based. That's a great tip, and that's one that most people don't know. What else do you have outside that one?
So another one, kind of going back to talking about the core, working your core and your pelvic floor, are really important. And you're working it for different reasons. You're not trying to get that six-pack, but you're trying to keep that area strong. So avoid any crunching, any forward crunching, any twisting, and add in things like planks, bridges, squats, pelvic tilts, cat and cow moves, and that will help to support baby as well.
Yeah, those are two, and I think it's real common with maybe how the female would think as they see that their abdomen's getting larger. Like, well, maybe if I do some crunches, it will help stabilize this. Yeah, I'd never even kind of tied that together until you said that.
Yeah, and we don't want the the abdominal muscles pushing out. So we don't want that crunchy motion. And it'll help with lower back pain during pregnancy, but it also will help you to potentially avoid diastasis recti, which can be difficult, a difficult outcome of pregnancy.
Yeah, that's good. Yeah, when that abdominal wall separates, it can be a very, very long time for that to heal.
Mm-hmm.
I'm going to throw some questions.
And all of a sudden that baby comes out and all that weight is gone and all that support is gone, but the belly is still there. And so everything just pushes down on the pelvic floor and you still have the relaxin. The body is still loose and unstable. So definitely talk to your chiropractor about stability things that you can do in that 4th trimester to make sure that healing is happening properly.
Love it. I always call this round the wow round when I throw a bunch of questions at you.
Yeah.
Best advice you ever got?
It only matters if it matters to you.
That's a good
I
one.
actually had a mom say that in my office pretty recently because it was right before Christmas and I was hanging out in the front of the office with a bunch of moms and expectant moms. And this one mom was, I haven't sent out my Christmas cards yet and they're not going to get there on time. And the mom said, honey, it only matters if it matters to you. And I really carry that a lot with me because one of the things you'll notice when you become a parent is when you become pregnant is all of a sudden everybody has advice for you. And I think it comes from a good place and people mean well, but everybody's different and stuff is going to work for your family that doesn't work for another. And as a parent, you have to weed through a lot of advice and information to find out what's right for your family.
Yeah, I love that. I haven't heard that one before, but I like that a lot. It kind of resonates with some personal things that we have going on right now. I like that. The invaluable resource, what's something maybe you're reading or something you turn your patients onto?
So there's a really good book by Genevieve Howland called The Mama Natural. I do like that book. It's like a week-by-week guide. There's a couple really awesome websites. One is called Spinning Babies. It's spinningbabies.com. It goes over a lot of pelvic floor and movement things that you can do. A lot of moms who have baby in a breech position, this is a really good resource for you. There's also a really good website called Kelly Mom. It's kellymom.com, KELLYMOM, and there's a lot of great articles. I actually found this website. It was from a mom in my breastfeeding moms group, and it has a lot of things that we ask ourselves questions about when we become a parent, like, is that green poop okay? And what do I do when my nipples are hurting really bad? And how do I get baby to sleep better? Or what is paced bottle feeding for nursing moms that have to, give baby the pump milk in a bottle? And all these questions and all these things that you really don't know what you don't know until you become a parent and you're like, wow, there's a lot of info out there. So kellymom.com is a really good one. And then for people that are looking for a Webster certified chiropractor in their area and more research on chiropractic with kids, the ICPA4kids.com, and it's the number 4, ICPA4kids.com.
The awesome resources, and I'll put those to the audience. I'll put those into the show notes so you can click on these ones that she just gave, and it'll take you right there. The favorite one I always like to ask because it hits home to a lot of people. It never fails. I'll either get an email back, somebody or a review back. It's like, hey, this hit home with me. And, until I heard this message that it resonated. But somebody out there who they're sick and tired of being sick and tired and they're just really struggling with just overall where they're at right now. They're down in the dumps. What's kind of the words of what's something you can pass on to them?
Something I like to remind people is, they always say, this too shall pass, right? So everything is kind of a phase. If you have a mom with a baby that's having a tough sleep routine or, they're going through a tough moment in pregnancy or dealing with, infertility, the opposite end of the spectrum, right? So one thing that works really well for me is writing things down, writing down goals, writing down affirmations. Something about writing it is very powerful. And I also think it's important to kind of find your tribe. I had a ton of breastfeeding difficulties in the beginning. I mean, sometimes I feel like maybe it was just helping me build my knowledge base to help all these moms that I take care of. But a lot of breastfeeding issues. It was really important to me to continue. I found a great lactation consultant. I joined this Breastfeeding Moms Facebook group. My husband was super supportive. So I found my tribe. And I think that's really important for moms as well. And honestly, just because there may be a moms group in your area doesn't mean you're going to have the same philosophy as those type of moms. So most of the moms in my Facebook group I've never met in person, but they know a lot about me. And it was really, really good support. And the last thing I would say is just be nice to yourself. You're trying. We're all doing the best that we can. And just be nice to yourself. We're really hard on ourselves, especially women and moms. I think a lot of times we feel like we're always failing and we're never doing enough. And just the fact that you're worried about it means you're doing good. So just, be nice to yourself.
Yeah, I love that message. Even if you're not pregnant at all, it's just, we're the toughest critics. We always think that we're just sucking it up and not doing what we need to be doing. And if you look back at things that we knock out just on a daily basis and achievements, it's pretty cool. So that was a great way to end it. Somebody who's trying to find you, how they go about it.
So my office is Livewell Chiropractic, located in Wexford. We do have a website. It's livewellpgh.com. I also have a blog called Babes and Bellies. It's babesandbellies.wordpress.com. And if you're local, you can usually find me at a lot of the expected parents events. So you can always check out our Facebook page. We list all the events coming up. We have one coming up called Bloom. It's sponsored by the Pittsburgh Moms blog. That's going to be at the AGH Wellness Pavilion in Wexford. I have one coming up called Babies and Bumps. That's going to be at the Marriott in Cranberry. And I am partnering with Babies R Us in Cranberry to do a Love Your Bump event. So we have a bunch of things coming up this spring.
Awesome. I will put all her info in the show notes as well. I've sent patients to her for years, and she's an amazing person, great person, but she's an even better doctor. And can't say enough good things. So Dr. Brie said it all. Thanks for sharing your message.
Yeah, thank you so much. Thanks for having me.
Awesome. To the audience, I look forward to talking to you next week. Have an awesome and blessed week. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.